Andrew has had to quickly kind of approach this at the state level and how to scale up these programs across communities. So Andrew, how did Curamericas quickly scale to run these types of community-based programs in counties across the state of North Carolina, which for folks who don't know, 14 million people, big state?
Yeah, thanks, Mark. And I think the reason we had to be here is because we saw at the beginning so much health information coming out, not in Spanish, and not reaching the people who needed it most, who are often forgotten and vulnerable. And so that's the values of Curamericas in our group here, is including everybody from the beginning. And Alexandra mentioned grassroots, from listening and more listening. It's so important. The way we were able to quickly scale is through community-based organizations, through grassroots organizations. And so Curamericas is partnering today with 20 separate independent CBOs, community-based organizations. They were here before Curamericas. Most of them were already doing work related to, for example, a food pantry or outreach in their community. They didn't have the funding and the support. They were still independent, not part of the system. And so Curamericas' vision is long-term partnerships where we are working inside of a system and strengthening that system. And so through these grassroots partners, we were able to quickly scale up to 180 full-time community health workers. 95% are people of color. Over 50% speak Spanish. They look like the community that they're serving. They're from the community that they serve. They speak the language, they sit and they eat and they pray and they stay with the community. And so they have natural trust. Of course, it's not the end all, but it's the important step. It's not Andrew going into a community and saying, here's what we think you should do. It is working with communities for them to establish their own protocols and procedures through their own community health workers.
And Andrew, the role of Curamericas as being somewhat of an intermediary between the state, community members, local departments of public health, what do you see as the role of that? Why is it critical both during the pandemic as well as after the pandemic?
Sure. I think that I've been thinking a lot about this recently. Like, what's the value added of Curamericas? Why are we here? Right. And so we have some values and vision for what health looks like that we think is important, which is why we're here, building trust and working from the bottom up. I think that's critical. I think we also are, as a managing organization, we're able to check all of the regulatory boxes that federal or state dollars require, or big donors are requiring, related to auditing and accounting, financial management, but also quality, data, evaluation. There's so many regulatory burden that comes in this work in the healthcare space that you're all familiar with. And many of the last mile implementers, the community-based organizations, the church on the coast, that is an awesome community-based organization, but they have never had an investment in their capacity to check these regulatory boxes. And so the donor often is unwilling to risk a big investment in a grassroots organization. And so Curamericas takes that risk on, but we also ensure quality and provide support. And each of our partners across 26 counties and 180 community health workers looks different: urban and rural, Black and Latinx, food and social services and wraparound services and schools. They all look very different, and their context looks different. And our environment changes day in and day out. The state, our biggest donor, North Carolina Department of Health and Human Services, is wonderful. Every hour, there's an evolution happening. We see that in the news today. And so how do we keep up? And so Curamericas is serving as that bridge to the donor, from the donor to the grassroots organization. But we're also doing, context-specific capacity building. So you're, as an institution, you have really strong fill-in-the-blank capacity. What can we do to help? Okay, you need more accounting support. We can help you with that. Or you need more monitoring and evaluation and data support. We can help you with that. Or you need some sort of technology that we can build with you. So it really is so context specific and so localized, right? It's really about listening from the bottom up. And often large donors don't have the interest, capacity, the ability to do that type of hand-holding or support with partners. And that's where Curamericas is saying that's our priority. And so as we invest long-term with partners, it's not just a one-off. We're hoping to build sustainable institutions, sustainable community-owned institutions. Of course, health is at the forefront of that, but behind a community health worker is the accountant, is the project coordinator, is the monitoring evaluation, and so many more things that support that community health worker to be effective. And that's where Curamericas is coming in to be that bridge.